Hello everyone, my name is Hui and this is my final presentation on the United States healthcare reform for HCA 300 with Professor Courtney Atkins. In my presentation, I will be separating it into three major parts. First one is the discussion on universal insurance coverage program for all Americans, and I will give some context on how it should be organized for our system. The second part of the presentation will focus on improving the quality and population health status uh, improvement efforts. And last but not least will be recommendations on how to decrease the inflation rate for our current US healthcare system. Moving off, first, we will focus on the universal insurance coverage that I will be discussing on some of the concept of universal insurance coverage by explaining what it is, why does the United States healthcare system need it, and how our system should be organized and financed to be able to support a universal insurance coverage program. To start off with, a universal insurance coverage program as defined by the World Health Organization is that everyone in the country will have access to the health services that they need without any financial hardships. It includes the full range of essential health services from health promotion to prevention, treatment, rehabilitation, and palliative care. The only current issue that we are currently having is that the US does not have a universal health insurance coverage. The only type of public insurance that we are having is Medicare and Medicaid, which Medicare is for people of 65 and above, and Medicaid are in it for individuals that have low income or are disabled. Uh, and as of right now, about 92% of the population have coverage in 2018, while leaving about 27.5 million people, or 8.5% of the population, uninsured, according to the Commonwealth Fund. So how should the United States healthcare system should be organized and provide universal health coverage to all Americans? As proposed by the American College of Physicians, they say that the United States needs a healthcare system that provides care for everyone, either through a universal health insurance system, similar to the UK National Health Service, or through a pluralistic system that involves the government and private organizations. The first option or system that they propose is a single payer run by the government system that covers for everyone without any barriers based on the person's ability to pay. The advantages of this single payer system are of it being more equitable for people with a lower administrative cost and offers greater user satisfaction rate. However, on the negative sides, it may restrict spending, creating shortages of services and limitations on the patient's freedom to choose their favorite health plan as we currently have, and a potential of delays in elective procedures. While the other option that we have as proposed by them is a pluralistic system that the government, private, for-profit, and not-for-profit organizations will ensure universal access while giving consumers the freedom to purchase private supplemental coverage if they need. The system will still guarantees that everyone has access to coverage, and the government will subsidize for people who cannot afford to buy coverage. The only cons to this system of pluralistic, it might create inequities in coverage and might have a higher administrative cost. In either options, consumers should receive a core package of benefits, and including preventative care, primary care that includes management of chronic illness and protection from catastrophic healthcare costs that the current system might give them to most Americans. Moving on to improving the quality and population health status of the United States, I will be focusing on how the system should be organized with key goals and priorities to improve the quality. As of right now, with escalating healthcare costs and a higher than ever number of uninsured Americans, it has heightened the need for a better quality in healthcare for our system. The Agency for Healthcare Research and Quality, AHRQ, has given a guide of quality improvement efforts at the local, state, and national levels through 3 key aims and 6 priorities are mentioned as followed. The 3 key aims created by them are improving overall quality by making healthcare more reliable, accessible, patient-centered, and safe for all. The second one is to support proven interventions that address the social, behavioral, and determinants of health to improve population health. Last but not least, to reduce quality care costs for many individuals, such as patients, families, employers, and governments, and making sure that it is affordable for all. The other 6 priorities are mentioned in the efforts to improve quality healthcare are reducing the harm caused in the delivery of care. And as I have read through journal articles, it has mentioned that medical errors in hospitals resulted in more than 210,000 deaths per year. And even with a 17% reductions in hospital-acquired conditions, we could save about 50,000 lives and about $12 billion in healthcare cost savings. To ensure patients and family are engaged in cares means that a report shows that in-person-centered care reduces the length of stay, lowers case and operating cost, enhances employee retention, and decrease adverse events. Promote care coordination and effective communication will reduce errors and overutilization of services, and to promote the use of the most effective prevention and treatment for the highest mortality diseases or leading causes of death, such as cancer or heart disease, and to also prioritizing to work with communities to enable health living practices like physical activities, healthy eatings, and making sure that quality care are more affordable for all individuals. Finally, I will be discussing on how the United States healthcare system to decrease the inflation rate and how it should be organized or financed in order to do that. I have come with after reading through journal articles and research papers, I have come with the conclusion that to implement a rate setting system that allows the patients a free choice of what doctors they want to see or hospital to visit, although the government will set all rates for what doctors get paid for those visits. And an example in our country that already is doing this is Maryland. The state is the only state that uses rate settings for hospitals, meaning that the state government decides what all Maryland hospitals can charge for a certain procedures. The system went into effect in 1976, and when Maryland has a hospital cost about 26% higher than the rest of the country, just over 3 decades later in 2008, the cost for a hospital admission in Maryland was down to the national levels, according to a Washington Post article. And other recommendations to decrease the healthcare inflation or increase care in prices, according to a journal article from the American Journal of Medicine, include reducing the administrative cost. As of right now, we spend 1/3 of our healthcare dollars on overhead and administration, like billing, advertising, profits, and bonuses for healthcare executives. And a study have shown that our complex and fragmented healthcare delivery system wastes about $210 billion per year on these unnecessary billing and administrative costs. We need to focus more on preventative care in order to decrease the inflation rates, as we need to shift from disease management to prevention and health promotion. Multiple studies have shown that generalists practice more cost-effective medicines than specialists, and that their patients usually have better health outcomes. So we need to have more primary care physicians or family physicians. We also need to eliminate unnecessary tests and procedures that are being done in our current system. We need to encourage all citizens to have living wills to avoid unwanted procedures at the end of their life, and to encourage all physicians to practice cost-effective medicines. Last but not least, our government need to control the cost of prescription drugs, and as has been being done in nearly every other developed nations, drug companies in the United States can charge as much as a higher of 20 or 40% higher than other developed nations where their citizens are paying. So overall, to conclude, the universal coverage um, insurance should be implemented to reduce the healthcare costs for all Americans by using the suggested system of a single payer system or a pluralistic system. This will help a bit in the current US healthcare system that is expensive and complex. However, yet the factor of outstanding health outcomes is not always met. Improving healthcare quality and population health status requires an attention in making it reliable and accessible for everyone, while at the same time to make sure that quality care is affordable for all, along with other key goals and priorities. Not last but not least, to decrease the inflation for the United States healthcare cost, we need to focus more on reducing the administrative cost, eliminate unnecessary procedures and tests, and to shift towards focusing on preventative care and control prescription drug cost. That should be the end of my presentation. And these are all of the sources that I have used. Thank you so much for listening.